Good morning, sir.
Good morning.
I came pharmacy here, sir. I'm Adi Saputro from pharmacist at Stikas Local Semarang. I am speaking with you. I'm sorry, sir. Any I can help?
Oh yes, I want to be medicine in this visit.
Thank you, sir. I'm as reading. Are you, sir, Mr. Rehan?
Yes.
IP address Jalan Uriajas Mororaya nomor 19?
Yes.
Dr. Sekan?
Yes.
Yes. No, sir. Dr. Anissa.
Oh, I will speak. Continue.
Thank you, sir. Sorry, sir. I have some question for you, sir. Do you have any moment, sir?
Yes.
Yes, I have. I want to talk about you one question. Has the doctor told you about the illness of the Mr. Rehan?
No.
No. Yes. Two question. Has the doctor explained the medicine that were prescribed?
No.
No, sir. Yes. Any moment has the doctor explained the expectation given to the Mr. Rehan regarding the treatment received?
No.
No. Yes. I understand, sir. I have the first question. There are several points that you need the answer in conscious, concise, and clear. Yes, are you ready, sir, Mr. Rehan?
Yes.
Yes.
I'm ready.
The complaint you feel?
Yes, I feel fever.
Fever?
When I'm urinating, it feels
Very
so hurt.
urinating.
And I feel dizzy because the doctor tell me that I have high blood pressure.
Oh, high blood pressure.
Yes, sir.
If you have any allergy so far,
Yes.
and the history of medical illness,
Yes. Medical illness. Oh, I don't think so. It's medical illness.
then the food that you are eat, food.
I don't really know food. This.
Yes, the Mr. Rehan activities the are being lifestyle every day.
I don't do anything like this food.
Okay, sir. I want to talking about you of the drug. The one is the four drugs at least. This, sir.
Yes.
I am Saputro. We describe of the drugs. The one for you prescribe at least give information about how to take a medicine according to the rules of the 3 times a day for in 1 tablet semaglutide. Yes. 1 time a day 1 tablet on the hydroxyacid. Yes. The distance of to use the drug is 8 hours. 8 hours. If the sick is the 2 times 1 tablet dexamethasone. Yes. The distance to the use the drug is 12 hours. 12 hours. If the sign of 1 time day 1 tablet samprima, the distance to use the drug is for 24 hours. Education of the for discipline. And just don't forget to discuss and consume for drugs. Beyond, if the patient of the forget is the ask to is the next drug use. If the next drug is still long, the ask to immediately ask the consume drugs. Consume drug is the next drugs. Use immediate skip the previous drug and don't double dose of the use. Yes, sir. Patient are given indication of a healthy lifestyle. Healthy lifestyle We want keeping the environment clean. Always wash their hand before meal. Avoid eating food from unhealthy environment. Yes. Do not use the drug together with milk. Juice, orange, because it will reduce the effect of the therapy. And this indication of the stored drug, namely drugs are stored at room temperature and are not exposed to direct sunlight. Yes. Attention to the related hydrochloric acid of the afternoon. Cimetidine before meals. Sun prima after before meals. The hypertension that is still prescribed, but at time of counseling said the lisinopril drugs is the bill still the continues. The page already is lisinopril drug. Follow the doctor instruction and be sure you read the information and direct on the drug patient label before taking lisinopril. To reduce the risk of the side effects, your doctor may start the treatment process and the low dose and increase the dose gradually. The dose is usually adjust to the medical condition and the body response of the treatment. We want lisinopril can to take with or without food. Lisinopril without food, use a glass of the water or swallow lisinopril. Take lisinopril according to the dose that has been determined. To do not increase or decrease to the dose without consulting your doctor first. Try to take lisinopril at the same time every day to maximize the effect of the drugs. For Mr. Rehan, who forget this drug, it is recommended to as soon as you remember. If the break without the compute on and on the schedule is not too close, if it is close, it's not in and don't double the dose. Lisinopril. Do not stop taking lisinopril suddenly or when you feel that your condition is getting better without consulting your doctor first. Perform regular blood pressure. Mr. Rehan takes will taking lisinopril to monitor the progress of the body condition. Lisinopril only help control high blood pressure, not to cure hypertension. It is possible that the patient will need to take this medicine for life to maintain normal blood pressure. Mr. Rehan. Treatment with lisinopril should be accompanied by adopting a healthy lifestyle, and eating nutritious food, quitting smoking, staying away from alcohol, beverage, and increase regularly. Can you repeat of the my information for me, sir? At this.
This is two times a day.
Yes, sir. 2 times a day. At this.
Excuse me, sir. I want to go to bed. This is hydro.
This is
once a day.
One time a day, yes, sir. At this.
This is cimetidine. 2 times a day.
2 times a day. At this century.
This drug is given 1 time a day.
1 time a day, and the one drugs lisinopril are discontinued, sir. Continue. For blood pressure, Mr. Rehan. Any question? Understand, sir?
Yes, I understand.
Alhamdulillah, thank you, sir. I am Saputro from here, Fakultas Teknik Semarang. For Thank you very much for Mr. Rehan. Thank you also.
Yes, thank you very much.